Hey everybody, I'm back just like that. Um, check see if we've got the audio working. What do you think of the thumbnail? Isn't it? um, yeah, that came through on a Telegram feed, and I said, "Well, there's a thumbnail, and there's a video I need to make because there's more to say, and probably worth recapping some of the things that I did say." And so, since it's been several days, and um, my mind has just been so full of so much other stuff. I can't remember exactly what I did and didn't talk about. I know some of the things I talked about. So if I repeat myself, I think that's good. And if I say something new, that'll be even better, right? So I had a situation where I went through. I am convinced I had a tooth abscess. Um, it was very, very painful. Um, and I used the never clear, non euphoric cannabis mouth rinse, which was helped me a lot. It really helped me a lot. And so I might have been doing that many, many times a day, anytime I felt the need for it. So maybe 5, 6 times a day. Um, and it would reduce the pain down. And then eventually the nerve died, and there was no more pain. Um, I've had several teeth abscess on me, and when I was suffering with the migraines, of course, that abscess tooth would always bring out a migraine. And for the life of me, I couldn't figure out how anybody lived through an abscess tooth. But without the migraine, it's a bitch, but it's bearable. Um, so at any rate, I'm convinced I suffered an abscess on a tooth, and that means it's a dead tooth, and I want dead teeth out of my mouth because they're infected. Well, then I had a problem arranging transportation. I had a problem getting an appointment, um, and um, and then sometime later, maybe 2 months later, I get this very sharp, hard thing sticking right out of my gum tissue, right in line with the edge of my tongue, and it's just shredding my tongue. It's sharp like the point on the round toothpicks. The round toothpicks they put in the sandwiches. That point, that very pointy point. Yeah, imagine every time you talk, every time you swallow, anytime you move your tongue forward or backwards, you're doing it against that toothpick. That's what this bone spur was like for me. The damn thing was like a fucking point on a toothpick. It was like a spear. And and while it was taking its time to grow and work its way through my gum tissue, that was painful. And then after it broke through, it's the damn thing's ripping my tongue up morning, noon, and night, and I'm miserable. So I called Dental Clinics North. They had a policy where you could walk in. You got an emergency, you could walk in. I called to see, do they still take walk-in emergencies? No, no, no. We're only doing 2 emergencies a day. So we're all booked up for a week. So a week from now, you can have your emergency appointment. All right, so I suffered with that damn thing for a week, and every day I'm thinking, okay, one day less, one day less, one day less. Okay, only one more day, and that day comes, and I have to arrange transportation, And I do. And I get there. And what do they tell me? They're going to give me an emergency evaluation. No emergency service for you. We don't have any dentist here who can do any dentistry for you. Welcome to the fucking dismal dental care of fucking Kalkaska County. Now, Dental Clinics North, several years ago, told me that if I ever talk about my oral health and cannabis again in their office, I will be barred for life. Well, maybe I wish I was barred for life. The fuck, you can't even get fucking service there. All this fucking high demand for emergency fucking dental care because of the fucking dismal fucking practice of oral health, because you're denied optimal oral health with cannabis. It prevents calcified plaques. It removes calcified plaques. It rejuvenates gum tissue. It prevents gum tissue loss. It puts a protective coating on your teeth. So, Ethan, how come you're having so much trouble with your teeth? Well, because several reasons. One, I'm old. A lot of my teeth had fillings. These fucking fillings decay. They degrade. And when that happens, your teeth start fucking rotting. I've been put in poverty by fucking government and big business. I haven't had fucking money. I have been denied cannabis for my own oral health. That's why. That's why I still fucking suffer with this shit. And I got fillings that need to be addressed. And I got a tooth that's got some decay. I've been watching that damn thing for over 2 years. I was at Dental Clinics North, had some work done, and I said, "Do you see any other decay?" They said, "No, it's fucking visible to me." I've been able to keep it at bay. I've been able to have some cannabis medicine from time to time. I had no experience with the non-euphoric, but that's what I've been able to have lately is the non-euphoric. And like I said, it's very helpful for pain. I found it to be tremendous for removing stain. The black stain on my teeth from smoking and drinking coffee. Holy cow, it's like it just peeled right off. So I'm very impressed with the non-euphoric, and I really want to be able to do more evaluations. And so that'll be coming. And I'm able to bring my harvest in. I don't have these fucking tyrannical fucks fucking denying me this. Holy shit. So what do you think of that? No more emergency walk-ins. We do 2 emergencies a day. We're booked up. We have 14 people with emergencies ahead of you. 2 of them have to suffer for 6 days. 2 of them have to suffer for 5 days. 2 of them have to suffer for 4 days. 2 of them have to suffer for 3 days. 2 of them have to suffer for 1 day. And you get to fucking suffer for 7. And then when you get here, we're not going to give you an emergency service. We'll give you an emergency evaluation. Ah. So then I start calling other dentists. Some of these motherfuckers won't even answer their fucking phone. What are they, too fucking busy? All this emergency work, you think any of them fucking come in early or fucking stay late? I don't think so. Do they give you fucking pain? Anything for pain relief? Fuck no. What they give you, what they'll offer you, what they'll push on you is antibiotics. Yeah, fucking go ahead, destroy my fucking microbiome, you fucking sick fucks. So, anyways, I did find a place that takes the walk-ins. over here, right in the village of Kalkaska, Birch Street Dental. And I walked in, and then they gave me an appointment for later that day. So I had to come back. And they told me to get there 20 minutes early for fucking paperwork. Well, I got there 10 minutes early. So they fucking rescheduled my appointment from 2:30 to 3:30 because I was 10 minutes early, not 20 minutes early. And why do I have to do their damn paperwork? Fucking nothing but invasion of fucking privacy. And then, what do I get there? An emergency evaluation. No emergency service for you. No, I'm not going to file that fucking bone spur down. Stop chewing tobacco, he tells me. He says, do you chew tobacco? Doesn't ask me if I smoke. I smoke like a fucking chimney. He asks if I chew tobacco. I do have a pinch occasionally. I don't chew it all day long. I enjoy a pinch. He says, stop chewing tobacco and come back and see me in 2 weeks. What does his staff do? Schedule me for fucking 5 fucking weeks. That's your emergency health care service in Kalkaska County. How's it in yours? How's your dental service, huh? Do they do anything for you except fucking make you fucking suffer in fucking pain? Deny you optimal oral health with cannabis? The fucking ADA and the AMA are the leading cause of fucking death in this country. Private member associations with bar agents. Every fucking one of them. Fucking poisoning us. 15 million poisonings every motherfucking year. Every fucking root canal is a fucking toxic tooth. Basically permanently installed to be a continual fucking poison fucking drip, especially when you chew. Now, the dentist did a x-ray, and then they did the panoramic x-ray, the real super duty, heavy, expensive one, right? He's telling me my tooth isn't abscessed. Your tooth is not abscessed, he says. He says, if your tooth was abscessed, it would be loose and there would be obvious infection. Well, the tooth isn't loose. None of my dead teeth were loose. I had a lot of dead teeth removed, and them dentists worked really fucking hard to get them out because they were not loose. No. So I said, well, do you have the device to check the health of the nerve? And then he's like, oh, says to the girl in there something or other about the thing, and I can't remember the last time I seen it. And here's a fucking piece of equipment that every fucking dentist should have, and virtually none of them do. Most of them don't even know what the fuck you're talking about. And all you have to do is take that little fucking fish hook and fucking put it on my lip, take that fucking thing, the tooth, and take that dial that goes from 0 to 10 and start cranking it up. And if you get to 10 and I'm not feeling a fucking thing, then I got a dead tooth. But he doesn't have it. He doesn't have it. Can you imagine a fucking carpenter without a fucking nail set or a chisel? Oh, I got a hammer and saw. What do I need a fucking nail set for? Dumb motherfuckers. For a man to not know his everyday job is a fucking deceit. Fucking American Dental Association fucking members, they fucking promote fucking poisoning and pain. And here in Kalkaska, they've upped it to a new level. No more emergency service appointments, only emergency evaluations. I'm not fucking happy. And I got a situation here with Birch Street. Yeah, they've been texting me. I've been texting them back. You see, I want to know if they can rearrange the schedule so that I can have a cleaning and then then an evaluation and then the extraction, provided that the tooth is dead. Now, see, the dentist, he said, he needed my teeth to be cleaned in order to evaluate whether I had any work that was urgent. I don't have plaque on my teeth. I learned it's saliva, carbohydrates, and bacteria that create the plaque. I minimize carbohydrates and I brush my teeth after every meal. And when I have access to cannabis formulations, I use it. I don't have plaque on my teeth. What I got is stain. And this motherfucker's taking x-rays, panoramic x-rays, visual, and cannot tell me if he sees any fucking decay or any fucking obvious fucking degradation of any fucking fillings. I can see it myself. I can see the cracks in the fucking fillings. I can see the fucking rot on the fucking tooth. I've been looking at it for 2 motherfucking years. Well, I've been able to maintain. I don't want to lose any more fucking teeth. I don't want you to lose your teeth either. Used to be men died with a full set of teeth at old age. This fucking diet has got a lot to do with it. Carbohydrates, saliva, and bacteria. It's your sugars, your pastries, your breads, all that stuff. All your food-like stuff. All right. Another video. Nobody here. No thumbs up. Rock on, America. Who's your dentist? Come on, YouTube. Let me out of here. I love you, everybody.